All right, so Dr. Taylor here, Chiropractic Clinic Plus. Got a patient here. Her name is Michelle, and we're just gonna keep her privacy. She's gonna just stay face down. So Michelle she's got neck issues, low back issues. Sometimes when she does like lifting and moving things and stuff like that, her low back will flare up on her. So we're just gonna kind of run through an adjustment. So she's got a right short leg. So I'm just gonna check and see if her hips are out. Challenge the right leg there, it is. So we're just gonna put some blocks underneath. So the good thing about the blocks is this can be shifting her hips while I'm working on the rest of her back. So this joint right here is out. So that's what we're gonna correct. Any tenderness in there, Michelle?
Not too much.
Not too much. So Michelle's been coming off and on for about how long?
6 months.
6 months or so. And what was it? A month or so ago you
About
really
2 months ago.
messed up your low back.
The mattress.
Lifting a mattress, probably by herself. And what happened to your back?
It was pretty messed up for like 4 days to even move.
And we
came and
worked.
saw you on the 4th day,
Uh-huh.
and you tried some stuff, the shots.
Oh yeah, that's another thing we do in here. We can do some homeopathic injections. So
Which I highly recommend as well.
yeah, so that worked really well. So yeah, tell them a little bit about the injection. So her back, she came in, she was super tight, lots of pain, did an adjustment. Did we do acupuncture too?
No,
We didn't do acupuncture, but the adjustment just didn't, because it was really, really, really bad. So I recommended that she do a homeopathic injection. And how did that go?
it went great, and I don't like needles, but I was willing to do anything, and it pretty much fixed it.
There you go. So we can do homeopathics for muscle spasms, for pain, for all sorts of things. So just having her on those blocks, her right leg is a little bit longer now. So we're gonna check out your neck. Now Michelle does not like to be popped at all. So we're very careful about that, aren't we?
We are.
We are. So that's just kind of a given. She tends to have really tight neck muscles, kind of stand out. But so we're just gonna go in here. And how's your neck been lately? Any headaches or anything like that?
No,
No?
pretty good. I've been coming regularly here, so that helps.
Yeah. So our neck's a little bit out right there. So I'm just gonna adjust you right here. And the cool thing about this is you can turn it up or down depending on how much resistance you want, how much pressure you want to put on there. So that's kind of nice. A little spot right here as well. So anybody who has neck problems, we usually, and we won't go into, but we usually give them exercises to do, whether it's reverse flies or rows, all sorts of things like that. If they've got low back problems, we usually do like core exercises, and not like the ones where you're going up clear up to 90 degrees. It's just more of like a crunch. Just gonna stretch a little bit right here. Not gonna do any crazy adjusting because she doesn't like that, and that's okay. We'll do a bit more muscle work here because her low back's really tight. We do, if someone's really tight and it's not super acute, meaning it just happened, then we wouldn't necessarily do the shots. We'd probably recommend a massage or something like that. Heat is always good too. So how's this feel?
Great.
Yeah. Most people like this percussor. It's really good. And then just gonna do the drop again. So it's gonna drop underneath you. Okay. And then one more. Okay. Legs are evening out. It's great. Again, just make sure your patient's doing their homework and have you sit up. How's that feel?
Amazing.
All right. So we're just gonna get you doing your homework even better now, and Alright,
Thank you.
so Dr. Taylor here again. We've got Chloe on the table. So Chloe had she plays a lot of basketball. So she's constantly moving her arms, wrists, shoulders, stuff like that. But she had a little trampoline injury. Tell us about your trampoline injury, Chloe.
Well, I get hurt really easily, so I was technically just on the tramp and I landed on the springs over by my tailbone and hurt it pretty bad where I could barely bend over.
Okay.
But
And after that happened the first time you came in, and what did we do? We worked on you a little bit.
yeah, we mainly worked on the lower area and
Okay.
it helped out with my back.
So you're able to jump on the trampoline again and
Yeah.
and do all your basketball stuff. Okay, great. So we're gonna check out her hips, her tailbone, sacrum, see what's going on. Chloe doesn't mind being popped, right?
Nope.
Yeah, she kind of likes that, so we might do
She
a
gets
little
that
bit
from
of
her
that
dad.
today. Yeah, just like her dad. So a little bit short on the left. So we're gonna check her hip here. And I like to check the hips because the hips are such large bones that if those are lined up, then everything else kind of like follows suit. So her left side's out, so we're gonna do the opposite here. Okay, good. And right there. So usually with the hip, and you're kind of ticklish, aren't you?
Yeah.
A little bit. So we'll see how well she tolerates this. We're gonna work on the muscles right here, because when this hip goes back, the glute muscles tend to tighten up a little bit. So we'll do this as long as you can tolerate it. Is that cool?
Yep.
All right. And so, any other areas going on, like the neck, headaches, anything like that?
My neck. It depends how I sleep because sometimes it just gets messed up.
Okay. And then, did you have a little issue with your elbow?
No, that was my sister.
Oh, your sister?
Yeah.
Okay. Got a bunch of basketball players coming here all the time. They should hold a summer camp one of these years. Alright.
Tony Robbins.
Yeah. He'd be all over that. Okay, so this hip is kind of being a little stubborn. How's this in here? Is that tender at all? No?
Yeah, kind
A little bit?
Yeah.
Okay. So I'm gonna use this for low back. So we can change out these little prongs for the kids here. So this one's a little bit smaller. And this one's more for the adults or larger areas. So when we go down to the sacrum, it's a little bit bigger of a bone. So we can go down like this. Is that tender at all, or does it feel okay?
It's a bit tender, but this is helping.
Okay. And then, so, I don't know if you guys have heard of craniosacral, but there's a fascia that connects in cerebrospinal fluid that kind of flows from the head all the way down to the sacrum. And so I'm going to work on the fascia, which is kind of the white connective tissue around the muscles and the bones. So a trauma like that, if someone sits on a trampoline or the springs and hits that, can really affect this area like that. So this percussor will help with that, hopefully. It did last time, so hopefully it'll help a little bit more. Sorry, you're ticklish. And then we'll work on the low back a little bit too. You ever had a massage, Chloe? Other than your mom and dad rubbing your back?
Not necessarily, but my aunt has kind of done one since she does massages.
Okay.
But
So that might not be a bad idea too, but we'll see how she does here. So do you have any problems with your neck or your mid-back or anything like that?
right over there, yeah.
Right here?
hmm
Okay.
Like lower, kind of right here.
Oh, down here?
Yep.
Okay. So I'm gonna fill a bit right there. And here. That tender at all?
Partially
Partially? Okay.
over there too.
So how often do you play basketball, Chloe?
Well, I practice at least every day
Every day?
if I can.
How long do you practice for usually?
When I'm shooting, I'm usually out there for 30-40 minutes, and then my sisters like to do queen of the court, so I get some playing time in too.
Okay.
And then practices 2 times a week, but we have trainings that do with skills and.
Okay. Which one's your favorite?
I really enjoy training.
Yeah?
I like to practice with my team, but training is really nice because I can work on the skills I need to.
So she's got some tightness up in her neck. Again, that's just from activity, kids being kids, jumping around, playing. Okay. So his hips being a little stubborn, so we're gonna use this. Okay. And okay, it's gonna drop underneath you. Okay. And then our sacrum and tailbone, so we're gonna just see how she responds to this. So we're gonna see if it needs to go back down that way. No. It's rotated at all. A little bit. So we're gonna put a rotation. So it's kind of clockwise. We're gonna go the opposite way. I'll adjust it that way. Okay. Good. Work a bit more on this. So this left hip's being a little stubborn, which is okay. Coax it back in, and if she needs to come back for a follow-up, that's totally fine too. So no big deal there.
She enjoys coming.
She does enjoy coming. It's fun here, huh?
Yeah.
Okay. All right. So we're gonna have sit up for me on the end of the table. And
This way?
yeah, just face that way right there. So turn your feet this way. Yeah. We're gonna do the hug. You like that one?
Yeah.
Scoot back about a couple inches for me. There we go. And I'll move your hair to the side. So this one's really good because we're kind of just getting into this area right here to kind of move the mid-thoracics. You're gonna put your arm on it like that. And I'm just gonna put my hand here. Take a deep breath in and blow it out. Good. Little pops there. Get some popcorn out of your back. How's that feel?
Great.
Okay. All right, you're all set.
Thank you.
Yeah, you're welcome.